dive today.
Yeah.
But we're going to be talking about something that's, I think, really important for a lot of people, especially this time of year.
Right.
We're going to be talking about Ramadan fasting.
Yes.
Specifically for people with diabetes.
Yeah.
And to help us do this, we've got...
a big topic.
Yeah, it's a big topic. And to help us do this, we've got 3 different YouTube videos from diabetes experts. Mm-hmm. 2 of them are kind of geared toward patients. And then 1 is actually kind of for healthcare providers.
Excellent.
So
a range of perspectives.
Yeah. So hopefully we've got kind of a range of information here.
Yeah.
And, you know, we know that managing a health condition while also trying to, you know, observe religious fasting, it can be tricky.
It is.
So that's really what we're here for.
Yeah.
We're here to give you the information you need to make good decisions that take care of both your faith and your well-being.
It's a delicate balance.
Yeah.
Yeah.
For sure.
It is.
And to kind of jump right into it.
Okay.
I was reading a study from Egypt that said almost 35% of diabetics didn't break their fast, even when they were experiencing hypoglycemia.
Yeah.
So this really shows how, you know, complicated this can be.
Yeah. It certainly does.
Right.
It certainly does. It really highlights the tension between those 2 things.
Exactly.
And the need for good communication and good guidance.
Exactly. So how do we even start figuring out if it's safe?
Right.
Because there are so many different factors, like what kind of diabetes, how bad is it?
Yeah.
Are there any complications, other health conditions, the medication?
There are lots of individual factors.
It can be overwhelming.
Yeah. And I think one of the ways that one of the experts frames it that I think is quite useful is to think about it as a sort of traffic light system.
Okay. I like that.
To visualize the risks.
Yeah. Okay. Walk me through this.
Okay. So green light means go. Okay. So in this case, that would be somebody with well-controlled type 2 diabetes. Okay. Maybe on medications like metformin or DPP-4 inhibitors, and without any major complications.
Green light, you're probably good to go.
Probably good to go.
Yeah.
Yellow light means proceed with caution.
Okay.
So this is where things get a little bit trickier.
Yeah.
This might be if you have type 1 diabetes or less controlled type 2. If you're on insulin.
Yeah.
If you're pregnant and you have diabetes, or if you have other health conditions on top of diabetes.
Okay, so yellow light, proceed with caution.
Proceed with caution.
What about red?
Red light means stop.
Okay.
And this is for people with poorly controlled type 1 diabetes.
Got it.
People who have developed complications like kidney disease or cognitive decline.
Yeah.
Or those who have recently had a diabetic coma.
Okay.
Or recurrent severe hypoglycemia.
Okay, so red's pretty clear. One of the things that the experts emphasize is that you can't just treat everybody the same.
Yeah.
Like you talked about this 69-year-old woman with a bunch of complications.
Yeah, her case is really interesting.
Yeah.
Because she was taking medications that were generally considered safe for fasting.
Yeah.
But because of her overall health picture, it was just far too risky.
Yeah, you really have to look at the whole person.
Yeah.
That's why seeing your doctor at least 3 months before Ramadan is so important.
Yeah.
Because that gives you and your doctor time to go, okay, what are the risks here?
Right.
Do we need to adjust medication?
Exactly.
And you can come up with a plan together.
And come up with a personalized plan.
Exactly.
Yeah. It's not just about the medication in isolation.
Exactly.
It's how all the pieces.
It's all the different pieces.
Together.
But, you know, I'm thinking some people might be a little hesitant to even bring up fasting with their doctor.
I can see that.
You know, like maybe they think it's not really a medical issue or they're worried about being judged.
Yeah. I think those are valid concerns.
Yeah.
But it's important to remember that Islam prioritizes health and well-being.
Yes.
You know, above all else.
Absolutely.
And there are clear exemptions from fasting for anybody whose health could be jeopardized by it.
Yeah, and one of the experts even says, and this is a quote, "It is worthy to be noted that in all 3 types, the patient should follow the physician's prescription. If he finds that he should break the fast, a person should break the fast.
Right.
If the fast is too risky for them."
That's a good reminder.
Yeah, it really is.
Yeah.
It puts it into perspective.
Yeah, your health comes first.
Yeah.
And to drive that point home, another source even mentions that it's considered a sin.
Wow.
To endanger your life by fasting when medically advised against it.
Wow.
So
that's a powerful statement.
It is.
Yeah.
It emphasizes that there's no shame in prioritizing your health.
Yeah.
And that your faith supports you. in that decision.
Right.
So we've talked about the different levels of risk. We've talked about exemptions.
Yeah.
And that leads us to another crucial element, blood sugar monitoring.
Yes. Monitoring is so important.
Yes.
But I think sometimes people think, well, if I check my blood sugar more often, I'm just going to find more reasons to break my fast.
Yeah.
You know?
That's a common concern.
Yeah.
But thankfully, research shows the opposite.
Oh, really?
Yeah. Frequent blood sugar monitoring actually leads to fewer hypoglycemic episodes.
So it actually empowers you.
Yeah.
It doesn't make you feel like...
It takes away that fear factor.
Yeah. Yeah.
That you're going to find something wrong.
Exactly.
Yeah.
And I think one of the experts talked about how psychologically, like knowing your sugar is low actually makes it easier to break the fast if you need to.
You know, they said that knowing your numbers are low helps you mentally prepare for the possibility of breaking the fast.
Yeah.
Which reduces feelings of guilt. Oh, that makes sense.
Or failure.
Yeah, like I'm ready for this.
Yeah, you're not surprised by it.
Right.
Yeah.
That makes a lot of sense. And speaking of monitoring, have you explored the different types of monitoring that are available?
Right.
So you've got traditional finger prick glucometers.
Yep.
Continuous glucose monitors or CGMs and flash glucose monitoring. They each have their own pros and cons.
You should talk to your doctor about those.
Absolutely.
But whatever method you're using, you've got to know how to recognize the symptoms of both hypoglycemia, low blood sugar, and hyperglycemia.
High blood sugar.
Yeah, so can we run through those quickly?
Yeah, absolutely. So with hypoglycemia, you might experience things like sweating, trembling, a racing heart, irritability, anxiety, nausea, headache, even numbness and tingling.
So those are the red flags for low blood sugar. What about high blood sugar?
So when your blood sugar's too high, you might feel increasingly thirsty, weak, and have a headache.
Got it.
You might also experience blurred vision and find yourself needing to urinate more frequently.
So it's just really about paying attention to your body.
Yeah, tune in.
And knowing the signals at either end. Now, we know that medication is a huge part of diabetes management.
It is for many people.
Yeah. So how does that play into Ramadan fasting?
Well, the good news is that a lot of diabetes medications can be safely adjusted for Ramadan. The key is that those adjustments must be done under the supervision of your doctor.
Don't try to DIY this.
Do not DIY. This is one where you need professional guidance.
So it seems like most oral medications are pretty straightforward. But there's one that often needs tweaks, and that's gliclazide.
Yes.
Also known as diamacron.
Right. Gliclazide is known to cause hypoglycemia. So it's often switched to a different medication. Or the dosage is reduced, or the timing is adjusted. And for people on insulin, dose reductions are almost always necessary. That's right. But the exact amount and timing of those insulin reductions is very individual. So again,
talk to your doctor.
Close collaboration with your doctor.
Earlier, you mentioned a sick day medication list.
Yes.
Can you talk about that a little bit?
Absolutely.
Like, why is that important for people with diabetes, especially during Ramadan?
So this list includes medications that can be dangerous if you become dehydrated, including some common blood pressure medications and pain relievers. And it's crucial to be aware of this list in case you get sick during Ramadan.
So if you're feeling under the weather during Ramadan, check that list.
Check the list.
Talk to your doctor.
Okay,
so we've talked about medication, but even with the right medication, lifestyle choices play a big role.
You're absolutely right.
In how your body handles fasting.
And if I had to pick the single most important lifestyle factor, it would be hydration.
Hydration is key.
It is absolutely key.
But it's not just about chugging a gallon of water before you start.
No, it's about being strategic with your fluid intake. And one of the experts shared some really practical tips.
I love practical tips.
Me too. So at suhoor, which is the meal before the fast begins, try drinking a glass of water when you wake up. Have your meal, and then have another glass of water afterwards.
So that's 3 glasses down.
3 glasses down before the fast even starts.
Before the fast even starts?
Exactly.
Wow.
And then when you break your fast at iftar, start with 1 to 2 glasses of water.
Got it.
And then continue to sip water throughout the night. Especially during prayer times.
Great tips.
Yeah.
What about food choices?
Yeah.
What should people be focusing on?
So I think the glycemic index.
For better management, please visit DiabetesWala.pk and consult Dr. Irfan Safi, the leading diabetologist. Please like and share this public service message.